Yes, top of the moment to every eye where they watch us. Plus, say na Health Matter where we dey carry come every Saturday, 8:30 a.m. go reach 9:30 a.m. The show will be say we web am around Health Matter. That is everything we get to do with wellness, with well-being, with staying fit. My name will never change. Na still Chief Olododo, and most definitely our doctor will take us through this journey of Health Matter. His name is still never change. Na Dr. Bat Ofegbulam, wey be the oga inside Grace Valley Medical Center. Welcome, sir.
Yeah, Chief. Good morning, sir.
We are so happy to have you here again.
Yes, I'm pleased to be back too.
And we say thank you very much for the cardiologist brought last week.
Thank you very much. Thank you very much.
So,
and on that note, I want to say a very big thank you to
Dr.
Ramon Moronkola, who was with us last week. He did justice to the topic, COVID-19 and the heart. For this morning, we'll be looking at the overview. We'll be laying emphasis on testing. We have been getting a number of questions from a lot of Nigerians. What is going on? Is it that we've been able to flatten the curve? Our numbers are declining. We'll be looking at all of this as we go into the program proper today. The topic, don't forget, is still COVID-19 pandemic.
The longest topic ever. I wonder if we can have a topic.
So difficult to let go.
We can't have a topic that will take this long.
It's so difficult to let go. Because when you think the world is beginning to at least hit the gold mine, we are taking our back again. Just last Friday, WHO sources said that the world recorded what was regarded as the highest daily caseload for coronavirus infection globally. Over 350,000 individuals were infected in one day, and that, of course, stood out as a record. So far, 350,000 individuals were infected. Now, it is important to point out this, and of course, we look at the African sub-region, how it concerns us. Yes, I must admit that the coronavirus pandemic, globally, the numbers has kept on climbing. At the moment, the total number of individuals affected globally stands at 37,113,410 individuals. Once again, my source is worldometer.com. 37,113,410 persons have been infected with COVID-19. And out of this figure, over 1 million have lost their lives. Unfortunately, 1,072,712 persons have died, have succumbed to this deadly contagion. Suffice also to say that over 27 million people, 27.9 million persons have equally recovered. And I said a while ago that on Thursday, precisely, the world saw what stood out as a single daily record. WHO sources put it at over 350,000 cases. And with that, we want to look at the figures we have been getting in Nigeria and, of course, Africa. Let me start by saying that at the moment, South Africa still tops the chart in the African sub-region with 686,352 persons currently affected or infected in that country. Suffice also to point out that out of this number, the recovered numbers of people are equally included. The new cases that South Africa saw in the last 24 hours was 1,461. And next to South Africa is Morocco. Morocco has seen 146,398 infected persons in that country. And the new cases they've seen or they saw in the last 24 hours was 3,445. And Egypt comes third. 104,262 is the current caseload in Egypt. Over the last 24 hours, Egypt has seen 106 infected persons. Ethiopia is on number 4th with 82,562 infected persons. And the last 24 hours, Ethiopia has seen 865 new infections. Nigeria comes fifth with 59,992. Just 8 short of 60,000. 8 less than 60,000 green milestone. Okay, and in the last 24 hours, the number of new cases in Nigeria stood at 151. I want to point out that it is true that the number of cases in Nigeria have continued to decline. But what are responsible? That is the question that has been agitating.
What are the factors responsible?
Yes, responsible for all of this. I also would like to point out that the fatalities we saw in Nigeria from the 1st of October, the number of people that have died in Nigeria has remained unchanged. 113 individuals. 1,113 persons have lost their lives. From 1st of October till today, we have not recorded any new deaths. And of course, we are happy with such a situation. And we wish such will continue. But it will continue only if you and I do take the necessary measures. Talking about infection prevention protocol. Of course, we know what it entails. Making sure we social distance when we're in public places, ensuring that we wear our face masks correctly at all times, washing our hands under running water, where that is with soap over a period of 20 seconds, where that is not feasible, you can actually make do with hand sanitizer that must have at least 60% of alcohol content by volume. Now, what can we say has been responsible for the declining number of cases that we have seen in Nigeria? A number of factors could be responsible, but let's start from the knowns to the unknown.
Okay.
Number one, I tried to look at the statistics from 1st of October till date in terms of the number of states that have been able to report cases within this period of time in the last 10 days. 1st of October, only 14 states were able to report cases. 2nd of October, 12 states reported cases in Nigeria. On the 3rd of October, we had 13 states recording cases in Nigeria. On the 4th of October, we had 9 states. Now, let me go back a little bit. On the 1st of October, when we had 14 states reporting cases in Nigeria, we had 153 new cases. While on the 2nd of October, when we had 12 states reporting new cases in Nigeria, we saw 126 new cases. 3rd of October, when we had 13 states reporting cases in Nigeria, we saw a total of 160 new cases. And of course, on the 4th of October, when we had only 9 states that reported new cases, we recorded 58 new cases. You can notice the trend.
Of course.
The fewer the number of states that are reporting, the fewer the number of new cases
that are being recorded.
That are being reported. Okay? On the 5th of October, 13 states recorded new cases. And of course, Nigeria had a total of 120 new cases. And on the 6th of October, 118 new cases were discovered, and 14 states were responsible for these figures. And on 7th of October, it came down again to 8 states, and we recorded 155 new cases. Now, you can imagine if all the states in Nigeria, including the FCT, had actually conducted tests at this particular, before this time, we probably wouldn't have gotten 155 new cases. Okay? Now, 8th of October, 13 states reported cases. We had 103 new cases.
103.
Yes. And of course, the last I have on the list, 9th of October, 10 states reported cases. And of course, we discovered 151 new cases. And so far, Nigeria has been able to test 548,514 persons. That is the number of tests we have conducted in Nigeria so far. We have gone above the 500 mark. But when you look at this, when you match the number of tests we've been able to do in Nigeria with respect to our population, you discover that it's just a drop in the ocean. I also would like to point out that yes, we may have started.
So sir, if we want to enumerate now, we can say the first factor responsible for what we feel is a flat in cough is shortage of tests.
Yes.
Okay.
As a matter of fact, NCDC, a doctor in NCDC, the video will see it in the course of the presentation, has actually come out to say that there has been about a 36% decline in the testing capacity that we have seen in Nigeria, at least in the last 1 month, in August. And I can tell you that this has not changed. So should we be able to test more? Obviously, Nigeria should be able to report more cases. So you can discover that the fewer number of cases we are seeing, one of the major factors is the fact that we are dropping in the number or in our capacity to test. And of course,
Dr. Batsa, in a situation where, okay, we have not been testing enough, agreed, and this is responsible for the shortage we're having in reports. But in a situation where I want to sound a bit. Go
ahead, sir. Go ahead.
Medical now. Let me use that word now. Where people are not coming down with this disease. Is it a threat? Is it something to really panic about?
Now that's a different kettle of fish entirely. There could be a number of reasons why we are not seeing the number of fatalities that are being seen in Europe and America. There could be. We've mentioned some of the reasons. That's why I said let's start systematically. Okay. Let's start from the unknowns from the knowns and then to the unknowns. So one of the major reasons why we have started seeing declining number of cases in Nigeria is our decreasing capacity to test for COVID-19.
Shortage of tests. Well, we have plenty of time today and we have plenty of questions and most definitely when I say we did here, we have enjoyed us well because we get the whole of today for now. We'll open phone lines as soon as we are back so that everybody go feed they ask questions where they do the amani on top COVID-19. Health Matta 9 will still they do go nowhere. We will be right back.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers. and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Hello, my name is Dr. Kenny, and I want to share some life-saving information with those of you above age 60, like me. At our age, we are at a much higher risk of severe illness and even death if we contract the COVID-19 virus. Also, those of us with underlying health conditions like cardiovascular disease, diabetes, chronic respiratory disease, cancer, and obesity also face the same danger. However, we can prevent and stop the spread of COVID-19 by ensuring we stay at home as much as possible. Wash hands with soap and water, sanitize hands and surfaces, wear face masks when in public, avoid crowds and maintain physical distance, and importantly, stay away from people without face masks worn properly over their nose and mouth. COVID-19 is endangering more and more Nigerians, so please protect yourself and others. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Baba Risi, you been dey sleep when government motor show for inside area this afternoon. No, now so them take enter Sisi Clara house. Where did the other side? They can't come out with some kind medical equipment. But it be like say she don't catch the coronavirus where people they yarn about. Oh, itself we no safe for inside area again. No, Kai, I no go even pass that house again.
Mama Risi, haba. Sure you no know say they good make government to check everybody where they suspect say they don't contact with people who don't carry the virus. You know mean say they get them now. Even if to say the person get them, it means say they go just carry them, make he collect treatment. If person get the coronavirus, you know mean say the person don't die. Person fit still recover. Or when they don't suspect say somebody get them, then go do test. Then fit even treat the person fast. Plenty people will catch the virus. After they collect treatment, they recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC, and them partners them.
Yes, it's an educative and also an interactive show, because now show will be say we give you the platform to talk any way they do you as far as health they concern you. We give you the platform to even ask personal questions that relate to your well-being. The doctor will they here will be Dr. Bad self. They kaja to answer any question we you throw give them. And the one will be say they personal, tabi too personal. Information go pop up for screen so that you go feel contact them one-on-one. We no feel commodify say secrecy or confidentiality it dey inside Health
Very
Matter.
key,
So
very
a
key.
very key thing be that. So as we dey go back to Dr. Bat now, vis-a-vis the questions we have for him, abeg make we try. Make him personal info, make it show for screen. Dr. Bat, like I said, it's going to be a give and take. Here's our phone number. It is on our Skype and WAP TV self. They are available so that if you see us, we feel see you. We would let you continue with the literature, with the delivery of the lectures you're doing, but vis-a-vis, we'll be asking some questions along. The very first question I'd like to ask Dr. Bat is the issue of lab and testing. Presently, how many labs can we say we have currently in Nigeria? Plus, how far are they doing in terms of testing capacity? Same on that question, sir. Same on that question. The international community to test over there, because yes, I know you have friends who are doctors all over the world. One of your staff just even traveled out, a person of Dr. Matt. Yeah, kudos to him.
Thank you very much.
Yeah, the question is it expensive over there to test too, like we are currently expressing here? Because if you say 50,000, 60,000, this is above what an average Nigeria can afford. So is it the same over there too, or is it people that are actually running away from the test here? What can you say is the reason why we have shortage of tests in Nigeria? Plus, how many labs we have?
Okay, let me start from where you started. I must give kudos to the federal government, okay, with respect to the good work the Presidential Task Force on COVID-19 has been doing since this pandemic started in Nigeria. Kudos to them. Kudos to all the frontline health workers. A good number of us have actually paid the supreme price in the course of this duty. On that note too, I want to also point out a painful story though. One of the NCDC workers lost his life in the course of his duty, on the line of his duty in Imo State. I think some few days ago, Mr. Njoko or so, may his soul rest in peace. They were said to have been ambushed by some unknown gunmen who opened fire on them, on their vehicle, and of course, the young man didn't survive. Now you can see that lives are being lost in the course of trying to keep Nigeria safe, not just by health workers, paramedics, and all others who are involved in those in this fight or response against COVID-19. So I want to start by saying that at the beginning of this pandemic, Nigeria had only 2 labs that had the capacity to test for COVID-19. And as we speak at this moment, we have a total of 108 labs in the country. 108 in the country that have the capacity. We have Gift from Rivers. That's Gift, great. Good morning.
That's great. Good morning, Gift. Hello, Gift. Okay, network. Please try call us back,
thank you.
Gift.
And then among these 108 labs that we currently have in Nigeria, 17 of them are private labs. They are privately owned. 69 are molecular labs, PCR labs actually, while 22 of them are actually gene expert labs. So if you add up the numbers, you get 108. This on its own, I must also be quick to point out, one would have expected that having gotten this large number of labs, we should ideally be testing more. So that is where we have to work on. We have this number of labs. About 2 or 3 days ago, NCDC came out to say that all the states in Nigeria at the moment have the capacity to test for COVID-19, of course, including the Federal Capital Territory. But what do we have on ground? You discover that it's just about 5 to 7 states that have actually kept faith, okay? I think I will be able to mention the name at that stage. Okay. Lagos has been in the forefront. Okay. Kudos to the incident commander and the deputy incident commander in Lagos State, of course, being the epicenter. Other states have been doing very well in terms of testing, that if you probably get to say 5 states tested or 6 states or 7 states tested over the last 24 hours, you can be sure you see Lagos among the numbers. You also see Plateau State, you see Kaduna, you see Oyo, and of course you also see which other states now? Oyo State,
Okay.
Ogun State, 2. Okay, so these states, anytime you have a number, 8 tested in the last 10 tested, watch out for these states. They must at least report.
Lagos, Plateau, Oyo, Ogun.
Yes, Ogun State. They are doing wonderfully well. Of course, Edo is not equally lagging behind. But we need to do more. Having this number of labs are just on paper. Okay, so we need to put them to good use. Okay, so that brings us to the cost of testing in the private lab.
Vis-a-vis international communities.
Yes, vis-a-vis international community. Now, I do know that most of the foreign nations, most of the Western countries, testing for COVID in some of these places are actually free.
Wow.
So I don't know of any country,
kidding me?
Yes, where one has to pay for those tests among at least Europe and America, at least for now. Now, talking about what it costs to do a test in Nigeria, I'm also happy to say that at the beginning, when about only 7 diagnosis centers were accredited for testing, government actually pegged it at 50,400 or thereabout. But in reality, none of those diagnosis centers actually kept faith with that particular figure.
Amount.
Okay, so the tests were ranging from that particular benchmark to up to 80,000, in some cases up to 100,000. Okay, I know a number of Nigerians who have actually come out to say that they pay so and so. But all of that are beginning to change. At least I engaged a diagnosis center that will be carrying out a test by 11 a.m. today. One of my patients who suspected that he or she may be having issues along that line, and they are going to collect from him or her just a token sum, just the benchmark sum of 50,400 naira, one of the private labs. So at least they are sticking to government directive. Okay. Now, that said, I also would like to point out that testing in government-owned labs are totally free in Nigeria. We must get that. Okay. We must get that fact clear. They are totally free, but it is difficult getting tested in these centers. From people's experience, there are a set of guidelines that not everybody that can be qualified to go there. Now, if you have a need to be tested and your need has to do with traveling protocol, I want to travel to Obodo Ibu and I want to be tested. Yes. It is when you choose to be tested, when it is by your choice, you need to pay for it. But if it's as a result of ill health, illness, and of course, such a person may have certified the guidelines for testing in public places, I'm sure such a person would get tested. But in reality, the numbers that we are seeing are not what should be coming out from 108 labs. I think I stand to be corrected on this.
Yeah. Okay, Dr. Ba, thank you very much. And you've succeeded in answering the 2 questions. And the very next one I'd like to ask now, vis-a-vis what is actually also popping on our screen, you can see the NCDC handle with things where they show that is the current happenings plus the response where they get, even the DG, as far as NCDC safe, they're very active there. So while they read up that, Dr. Bat, the video where you showed us some minutes ago, we saw that of SARS, MERS, COVID-19, and every other thing. That's now, that's it pushed me to want to ask this question. Say, is it not high time we stayed away from some wild animals, from some scary wild animals? Because I have a friend who rears monkey. You know, some go tell you say they like porcupine. You hear very strange names. Yes, I want to believe cat is a domesticated animal and something we all grew up with, but yet, Dr. Bat, with SARS, with COVID-19 also coming from animals, water animal like that, whatever they call it.
Seafood.
Seafood. Dr. Bat, is it not high time we stayed away from some scary wild animals? Even the one we consume, some scary wild animals we consume. Some eat bats. Some eat, I'm not saying it's bad, but is it not high time, sir, we withdrew from such?
Thank you very much for that question. Over the years, we know about zoonosis, okay? zoonotic diseases. These are diseases
from animals?
Yes, that man can pick from animals. They're called zoonotic diseases. And we also know that some of those coronavirus strains that we have witnessed or that the world had seen some decades ago actually originated from animal kingdom too. Okay, top on the list was the SARS that emanated in China in the year 2002, 2003. It was from civet cats. It was from civet cats. And of course, the Middle East respiratory syndrome that emanated from Saudi Arabia, Arabian Peninsula in the year 2012, also came from animal kingdom, camel, Somali camels. Okay, that's the type of camel. And it is believed that this latest strain that is troubling the whole of universe may have emanated from animal, but they are unsure at the moment the exact animal. There have been a number of postulations. It could be snake, it could be bat, it could be this, but that has not been verified. It's not yet known specifically. Okay, so sometimes it's a common fact that these diseases thrive in animals majorly, but oftentimes there could be a jump to a human. Okay, they call it spillover. It could jump for a human and it can infect human. Now, my advice would be this. As much as possible, I agree with you that we should avoid animals, wild animals, as much as possible. Some of them that we eat in this region, in this part of the world, we must ensure that we cook them and cook them very well.
Some people will tell you they can't eat if they've not seen eran ogbe, eran ya, bush meat, bush rat, bush this, bush that.
But the challenge is actually the procedure of catching those animals and the preparations, not after it has been cooked. Okay, I think the risk will be more in catching, in the procedures that we usually use in catching them and then killing them to prepare them for to make merriment.
But once it's well cooked,
yes,
there might really be no problem.
Yes, there shouldn't be any issues if they are well cooked.
What about living with them? We've seen people who live with monkeys at home. Who told you monkeys are best pets?
Who keeps snakes even as pets? Such should be discouraged, at least at this time. Okay, or if we have contact with them, as much as possible, we must ensure that we wash our hands always. Okay, so that way, whatever we pick from them can actually be done away with. Okay, I still want to go back to the testing issue. I was happy when in the course of preparing for this presentation, I discovered that NCDC has actually come out to acknowledge that WHO has given emergency authorization for diagnostic kits, for 2 diagnostic kits, antigen-based diagnostic kits.
We saw that on the screen.
Yeah, that can be used for COVID-19, but they're still working out modalities, okay, on how this can be applied in Nigerian environment.
When you say antigen-based diagnostic kits, what do you mean, sir? What do we mean?
Now, these are test kits. We'll call them rapid test kits. Okay. They can give results within minutes. Okay, so we may have a situation where private hospitals, where other health institutions will be able to test people that they may suspect that they have COVID within minutes, within 10 to 15 minutes. Sometimes some of them may not last up to 15, 20 minutes, and you have a result on your hand.
What is the potency of these results, sir?
They may have their limitations, though, but such results are usually subject to confirmation. So when you probably have a negative, when you have a positive result from such a means, you still need to go for confirmation using PCR, polymerase chain reaction test, real time. Okay, so these antigen-based or antibody-based tests are not to replace the PCR testing, okay, methodology. That still is the number one. And of course, I do know that we've been reading difficulties and challenges that travelers that are coming to Nigeria are currently experiencing with regard to a protocol, traveling protocol that Nigeria has actually issued out. It's no longer news that we have opened our airspaces since the 5th of October. Yes. Ghana also did on 1st of September. South Africa is going to do so on Ghana did it on 1st of September. South Africa will be doing theirs, I think, on the 1st of October as well. Now, with this came a number of protocols that have been put in place so that we don't have a situation where our modest achievements so far in our response to COVID-19 will be lost by way of allowing people who are infected to pour into the country. Okay? So, of course, the NCDC, through Nigerian International Travel Portal, has actually come out to give a guideline that people who want to travel to Nigeria must meet these guidelines before they can actually board aircraft. Okay. I can tell you that of Nigeria appears to be the most, in terms of the timing that you need to do the PCR test before you embark on such a trip. Okay. Nigeria has given 120 hours, which is equivalent to 5 days. So you must get, if you're coming into Nigeria from any part of the world, you must ensure that you get a PCR test done, at least within 5 days before you travel. A number of other countries limited theirs to 72 hours. And even at that, people still have challenges. And of course, when such a person arrives in Nigeria, there will also be need for further actions to be taken. Okay, such people are expected to isolate for at least a period of 7 days. And after the isolation of a period of 7 days, they will be tested again using PCR. Okay,
Dr. Matta, I quickly want to talk about the antigen-based test kits that you made mention of. The way it sounds, to give us quick results, and the medical economic aspect of this, I assume, is that these kits should be affordable.
Yes. Rapid-based test kits are usually very affordable. Okay?
Let me use by simple private medical centers. Simple. I use the word simple because I'm talking about the expensiveness now. So the question I want to ask now is, Dr. Matta, the way it is, are we saying we might in a matter of few weeks see normal hospitals conduct COVID-19 tests with the antigen-based test kits?
I hope so too. That was why I said that when I saw that NCDC has actually come out to acknowledge that WHO has given an authorization, temporary authorization though, to such a test kit, it gladdened my heart. At least a number of hospitals will now have the capacity to test some of their patients. And I can tell you that some emergency situations that when you see as a doctor, you know that these are classical signs of COVID-19. But such a person may be in a center where he or she may not get the needed medical help or medical assistance. That actually brought about a lot of people dying for a number of easily treatable conditions some few months ago in Nigeria. But all of that are beginning to change now because of the government strictness in terms of insisting that COVID suspected cases must be treated in only government approved private hospitals. And as a result of that, a lot of hospitals were shying away, and of course that caused a lot of deaths unnecessarily.
But with this latest development,
if it can be approved, if federal government can sanction it, of course, it will be a game changer, without any doubt.
It will definitely be a game changer. Fatality rate most definitely will reduce. Another premise, let's go on this very short break. We will be right back. Health Matta, Dr. Matta in the building, go nowhere.
There are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime, and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils, and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking, or eating any of these is an effective treatment for coronavirus. Do not self-medicate and take responsibility by sharing only verified messages from health authorities such as NCDC, Federal Ministry of Health, and WHO.
How do I get tested? If you fall into any of these previously mentioned categories, remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen. The State Ministry of Health, supported by NCDC, will arrange for sample collection and transportation to the lab. Where can I get tested? There are several labs across Nigeria for the testing of COVID-19, and these labs are currently rapidly being expanded across the country to reduce turnaround time from when the samples are taken to when they are tested for the disease. And you can only get tested if you fit the criteria as previously mentioned, and a sample has been collected for testing by the state team. What do I do if my COVID-19 test is positive? If your result is positive, please do not panic. Many people who have the infection will show mild symptoms and they can recover quickly with just supportive care. And most of the cases recorded till date in Nigeria are mild to moderate and are clinically stable. What do I do if my COVID-19 test is negative? If your result is negative, it means that you are not infected at the time your sample was taken. However, it is still possible to get infected. Therefore, you should continue to practice social distancing. Wash your hands with soap and running water all the time. Use alcohol-based hand rub frequently and clean your environment all the time. Should I come to the Nigeria Center for Disease Control to get tested? No. If you fall into any of these previously mentioned categories, please remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen.
We all know wearing a face mask is not very comfortable, but the risk of getting infected with coronavirus is much higher when you are in public without a face mask. Ensure your nose and mouth are covered properly while in public places or in a closed area with several people. Wash your hands regularly and maintain social distancing. You are not at risk of getting infected from people who have recovered from the virus. Do not stigmatize against them. Stigmatization increases the chances of community transmission of COVID-19. Remember, anyone can get infected. Together, let's fight COVID-19. This message is brought to you by the Risk Communication and Community Engagement, Public Health Department, Health and Human Services Secretariat, FCT Administration.
Hello? Tunde, it's been ages.
Amaka, I'm so tired of this coronavirus pandemic. I am inviting you to my birthday bash next Saturday. All our friends are going to be there.
Wow, that is awesome. But I'm sorry. You know my condition now. I am managing and I can't risk corona.
Amaka, you're on even too much. Corona cannot affect young people like us.
That's not true. Coronavirus affects young and old people, especially those of us with underlying health conditions. We must be very cautious. I know families who have lost their young ones too.
So this coronavirus is real. I am calling off the party.
Even young people are at risk. Be like Amaka. Do not take risks. Wear your masks correctly if you go out. Wash your hands regularly. Maintain physical distancing. It is better to do over syllables than to regret.
This message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Okay, you're welcome back to the show. It's been a very educative one with Dr. Bat, as he done they take us through the journey of coronavirus, COVID-19. Dr. Bat, I would want us to quickly go through these two questions before we call it a wrap on the show. The very first one, the issue of face mask or face shield, though I wouldn't want to use the word face shield because you told us it's a no-no thing, but face mask now. Face mask. Are there things we should know? Most especially in this rainy season, are there things we should know medically now that as relates with a face mask? Then the other one, it will be very, very important, Dr. Bat, because from the video we will see, we don't say, okay, to cook this, work, to cook that, work. What are the ways we can quickly work or boost our immune system? Because that only is the only way out. How can we boost our immune system? We have to always talk about this. In as much as we know there is no panacea, no solution, no remedy for now. Immune system, good immune system is the only way out. So how can we boost our immune system? The last but not the least, I want you to pen down there. Sports as relates, exercise as regards COVID-19. Does it have any way? Does it help in any way? Those are the three things I want us to quickly look at, sir.
Okay, let me start with the first one. Yeah. In the last couple of days, WHO actually came out, and of course CDC as well, American CDC, actually came out to talk about the use of face mask in rainy season, or actually when they get wet or dampened. Now, the advice is that with respect to weather, depending on what part of the globe that one lives in, everybody should have at least a spare face mask, so that if it gets soiled along the line, or if you're beaten or soaked in the rain, now that we have rain almost all the time in Nigeria and some parts of Africa, you will need to change that face mask immediately. Number one is that the water will make it incapable of filtering very well. Number two is that the easy breathability may be compromised. Your ability to breathe freely through face mask may be compromised when they are wet. So you may need to change them so as to replace them with the ones that are dry again. Okay, so talking about face shield, according to the information I gathered from CDC, there is no scientific evidence that face shield alone without face mask offers any form of protection. And of course, we do know that NCDC has actually come out
debunk it,
to actually debunk and as well as issue an advisory on the use of face shield. It must be used alongside a face mask, not in isolation. Okay, but a good number of times you discover that people who use face shield, we see a lot of them using just face shield alone.
Majority for fashion, sir, because it's more expensive than face mask.
No, I'm not sure it is more expensive.
It is. I'm sure. You are not sure, I'm sure. When it came, it was 2,000.
Fashion, I agree.
Fashion, but when it came, it was 2,000.
A lot of our women who may not want their makeups to be soiled or messed up, they would rather go with a face shield than having a face mask. Now, if you're in the habit of doing so, now you know it doesn't offer you the type of protection that you may get if you use it alongside a face mask. It's important to point out that. And also, the need to disinfect such face mask before using it. If you use it today, Do not just get to your house and probably dump it somewhere. And when you're about to hit the road again, you pick it up. You need to disinfect your face shield. Okay? The simple way of doing it, if you have the plastic type, you can easily do that with washing it with soap and water. Simple. Of course, that is the way we wash our hands. Every family, every house should have soap and water. Sure. Okay, so that way you'll be able to disinfect your face mask. Now, are there conditions that will make people unable to use face mask? Okay. And are there age limitation with respect to face mask? Okay. CDC has said, and of course WHO, that children under 2 years of age should not wear face mask. Children under 2 years of age should not wear face masks. Anybody that has challenges or breathing difficulties may not be able to wear a face mask. Unconscious patients, people who are unconscious, okay, can equally not be able to wear face masks.
When you say people who have breathing difficulty, does this encapsulate people with pneumonia?
Yes, not just pneumonia, any medical illness. I thought you were going to mention the commonest one, asthma.
I think I was about to say
breathing difficulties. But it is not all the time that asthmatics will have breathing difficulties. Okay. It's actually when they have attacks. Okay? So pneumonia, on the other hand, occasionally may also present with breathing difficulties. So anyone has trouble breathing may not be able to wear a face mask. So such a person should look for other alternatives that such a person can afford to stay at home, avoid crowd as much as possible, and ensure that other infection prevention protocols are strictly adhered to.
How do we boost our immune system, doctor? Because of time, we don't have the luxury of time. How do we boost our immune system?
Now, the way to boost our immune system, of course, we saw the cardiologist and we had a number of things that he asked us to make sure that we do at this time. We need to protect not just our heart, but our bodies. And how do we do that? We need to stay healthy, okay? Healthy life practices, okay, is important at this time. Number one, we should ensure that we do not become overweight and obese. That will predispose us to a number of medical conditions. It may predispose one to becoming hypertensive, to becoming diabetic, to even having cancer, some form of cancers.
Obesity, just sit down, you don't move body.
Sedentary lifestyle will encourage obesity, and of course, is a risk factor for a number of other diseases. So we need to stay healthy. That will be the most important one that I will have to say on that. But other than staying healthy, a number of multivitamins have been proven to be helpful with respect to COVID-19. Top on the list is vitamin D. And of course, we do know that we have abundance of vitamin D in our environment because that's the only vitamin that you can actually get from coming out in the morning
free
sun.
Of charge, sir.
From God.
When you say morning sun, is it the 10 o'clock sun? Is it the 1 o'clock sun? Let's clear it to maybe we don't go carry malaria and typhoid.
No. 1 o'clock cannot be morning. Okay, so the morning sun, we all know what morning is.
Like
at least before 12 noon. Before 12 noon. And of course, apart from vitamin D, all other vitamins too have been proven to be helpful in building or stepping up and making our immunity a lot more robust. Vitamin C is equally in the picture. Okay, zinc is in the picture as well, and a number of others. Now, your last question was sports and exercise. What can it do? We do know that athletes, people who are into active sports, hardly do you see them becoming
they really fall sick.
No, not fall sick. Okay. Becoming overweight and obese. Yes. Occasionally that may happen. I'm a Chelsea fan, so I just had one player in mind.
Okay, and so what happened to Ronaldinho too?
That moved forward, left our club and ended up becoming overweight. Yeah. Now, because they exercise always, it is difficult for them to acquire excess baggage in terms of weight. Okay. So we need to stay fit at all times. And of course, eat a healthy diet. I must point that out. Very important.
Dr. Matt, it's a fun, pleasing pleasure to have you here today.
Thank
we believe the same time next week we will be doing the same. If you really enjoyed the show with us, why not keep it up? Lock down the same time next week, 8:30 to 9:30. We will be here with you. On that, to say a very big thank you to all our extended
Thank you very much, and we'll see you next week.